Bore da, a dda iawn I weld bod sawl cader wedi cael ei gymeryd yn barod, a mi'n siŵr bydd rhagor o'r cadeiru yn cael ei lanw yn ystod bore. Croeso I ail ganadledd yr ABPI, bydd yn edrych ar gydweithio rhwng y diwydiant fferyllol a'r NHS yng Nghymru. Welcome everybody. Hope you're all sat comfortably for what we hope is going to be an interesting and exciting few hours, or most of the day, in fact. So welcome to our second ABPI conference, focusing on and shining a light on collaboration between the pharmaceutical industry and the NHS. The advantages, the pitfalls, benefits, challenges, I'm sure all of those will come through in the presentations later today. Let me introduce myself to start off with, because I'm certainly looking at a few faces in the audience that I don't recognise. I'm Rick Greville. I'm the director of the ABPI down here in Wales, and have been for the last 13 years or so. I mentioned the 13 years because I'll come back to that a bit later. I'm sure most of us are familiar with Strictly Come Dancing, whether we want to be or not. And I like to think that today is an attempted view of, or we've adopted some approach within Strictly Come Dancing, and that is that of lens, yeah? And then he does a cheesy grin or whatever, doesn't he? But I won't bother with the cheesy grin. But if you consider today as either lens or Rick's retina or whatever, yeah, this is our opportunity to have a look at what is possible from collaboration. And in keeping with the concept of collaboration, I'd like to thank our collaborators as well alongside the ABPI today, that of the Bevan Commission and that of the NHS Confederation in Wales, or the Welsh NHS Confederation. I see Sandra still working at the background there. So that's great from our perspective, because it's really important for us to reach out as well as possible. So we do hope that we all benefit and perhaps learn a trick or two from today's presentations, not forgetting the positive spirit of the Euros 2016. Obviously, I'm talking from a Welsh perspective here, but I'm sure there may have been some positives that came out of the Euros 2016 for other countries as well. Perhaps a new manager for England will change things, but that's where we got the idea from for the name for today's conference. So we do hope that Together Stronger actually works for our context as well. In terms of housekeeping facilities, you will perhaps know that the facilities are towards the back of the building and behind reception, and certainly we aren't expecting a fire alarm today. He says checking with Joe, because I forgot to ask reception. But no fire alarm today, so if the fire alarm does go off, we will need to evacuate carefully and patiently, perhaps. Now let me introduce the chair for the day. It is my great pleasure once again to introduce Professor Trevor Jones. It's not the first time I've introduced Professor Trevor Jones, because 13 years ago, Trevor was the unlucky chap who decided to employ me for the ABPI. At the time, Trevor was the Director General of the ABPI. Now, since then, I would dread to try and list the things that Trevor does and has done. That's all I know, is that he's the most passionate Welshman ever to hail from Wolverhampton. So with that very brief introduction, let me hand on the rest of the day to Trevor. Thanks again.
So, if this is Strictly Come Dancing, am I going to be the person who thinks this is the most wonderful thing? Or will it be different, darling? How do we get up here? Thank you, Rick, for that introduction. Yes, it's my pleasure to be part of lots of things going on in Wales right now, particularly the Bevan Commission, which we're going to hear a bit about today, where the Minister of Health asked a few of us to try and take a blank sheet of paper to see how we could pull together all the things that could influence health and well-being in Wales. Good show. And I'm also the chairman of Simbec Orion. This is, many of you will know, a group that's growing and growing in clinical research. Our main headquarters is in Merthyr Tydfil, where Mansell Elwood created it years ago, naming it after his son Simon and his daughter Rebecca, which is an interesting way of naming a company. So, and I'm also chairman of the advisory board at Swansea, which gives me great pleasure. So, Rick, in an address in his magazine a year or so ago, mentioned this, that, you know, this is the challenge. Wales, as you all know, has got a hugely ageing population against the rest of the UK. And whereas currently 18% of the people in the last census are over 65, that's just going to grow and grow, and the estimate there is 26%. Now, okay, because you get older doesn't mean necessarily that you get sicker, but we do know from all the statistics that the challenge of health and well-being is significantly there in the older population. So this presents a really major challenge to how we're going to cope with that financially and resource it. And here's a piece of work done a couple of years back from the Nuffield Trust, and they looked at the projections, and as we heard from the Chancellor this morning on the television, economic projections are never very easy, but given all the sort of way that you look at the fundings of these things, the gap is simply going to grow and grow and grow to a massive amount that really is unfundable. And those of you who've been following the politics in the last 24 hours or so know that Wales didn't get any special. In fact, there was very little coverage in the autumn statement about health at all, but it certainly didn't get any special mention. And I want to show you some data about where Wales is in something as simple, because this is all part of an industry platform as well, on how well people take their medicines in Wales. This comes from a group called the Office of Health Economics, which is part of the ABPI's area, but an independent group that conducts economic research and consulting. And what they did recently was to look at where products are readily available, all approved by regulatory agencies, the EMA and so on, in these countries. And you can see that's European large and European small, as well as some other countries. Of course, the USA is probably a bit of an outlier there. And they said, let's look at different disease areas and ask the question, how are patients getting to them? And this is the Wales data. Now, when you get to 100%, that means everything up here is good news. In things like very specialised wet acute macular degeneration and statins use, Wales doing very well. But look at this massive tail down here, where the people in Wales are not getting all these advances in science and medicine that really make a difference to their health and well-being. And that's in things like, cancer, different groups of cancer, in diabetes and so on. It's a terrible factor, therefore, that people living in Wales are disadvantaged because the system isn't getting them the kind of care and the kind of medicines that they should have and are entitled to and are fully approved by the All Wales Medicine Strategy Group and NICE and so on. Now, it's fortunate that we are getting more and more data about Wales. That's data from OHE, but I was delighted to read from the Welsh Government pages and the NHS pages of these. There's lots more, but these happen to be some of the key papers that have been published very recently. And the one that I'm looking forward to reading is this one here. This is going to be published next month, which is the analysis of the 4 regions. So that's a much more tight analysis. It won't just be on medicines, it'll be care in generally. So I recommend that we all look out for that because it's a significant piece of work. And I'd like to thank the NHS and the government for getting that going. Now, even when you get medicines, the problem we've got is people don't adhere to therapy. I mean, I've seen that in my life with people not adhering to therapy when they've had a transplant. I mean, when you've had a transplant, the one thing you've really got to do is stop rejection. And yet people say, well, I feel okay. And you all know what happens when you get your prescription, you feel good after 2 or 3 days and stop taking antibiotics and so on. Look at your medicine cupboard. They're full of, most people's are full of not adequately used medicines. So whereas, you know, people with asthma and depression, it's still very poor against what they should be. But some of these areas here are really terrible. And, you know, we've got to find a way of people understanding that in order to get the benefit, the research we've done in the clinic, the research we've done in the real world says unless you do it this way with this regimen, you're simply not going to get the benefit. And we're going to hear examples of that during the day, of how the NHS and companies, both here and in England, have been working together to try and get people to adhere to their therapy and get the benefit they should be getting. So this is from the NHS Confederation, and this paper here, which I recommend if you haven't read, you have a look at, because it really is an interesting paper from the Confederation. What it says, obviously, we have made significant progress in recent years, but the next 5 years, for all the reasons I mentioned earlier, present this amazingly enormous challenge of how we deliver and transform care in the community as well as health in hospitals and general practice. And that's very importantly not just about putting the onus upon the caring groups and the NHS, but critically that in Wales that people are empowered and informed to take responsibility for their own health and well-being. That's just somebody else to do it. It's got to be everybody responsible for what they do. We need to find a way of partnering to do that. That's actually a principle that we have in the Bevan Commission, and you probably know that the Bevan Commission has created these 4 Prudent Principles. So often you get a diagnosis and then you have to do something prescriptive, whereas that's not necessarily the best for the patient and certainly not the best for the spend. And what we are saying is do what you must do, but don't do it if it's not necessary and it's not proven. And certainly we're seeing in Wales procedures and medicines and others given when, frankly, if you consult with a patient, their carer, and get an agreement, then you get better adherence, better outcomes, and it saves you money. So one of the things that we've been doing at the Commission is to look at, and equally the NHS Wales is the same idea. You know, we've got to reduce these inequalities and keep people healthier. So we know that the determinants of health are largely social. I mean, if in some of the deprived areas of Wales and England and Scotland and elsewhere, that's where the worst health problems are. So just focusing on a sort of average person doesn't cut it. One has to get to work with the community, in partnership with them, with those who can influence social change and not just the presence of therapy or care. So that's really important that we understand this social contract in health and partner together to try and change that. So what we've been doing, and this will all be published soon. Helen is here today. She's the director of our commission. Where's Helen? Over there. This is from this month that we are proposing a new prudent model of health, which places the responsibility to improve health and well-being across society as a whole, rather than just the health service. So one of the things I want to keep going today is not just what can we do industry, NHS or whatever, what can we do across the whole community? And in fact, we've got a meeting coming up on December the 7th here at the Millennium Centre, where we're taking the exemplars from all over Wales, bringing them together to share partnership arrangements. And I think you can get to that by going to #Bevan Commission, and you can have a look at that one, December the 7th. So again, a partnership discussion with the whole community. So here's an example we heard last year, and we've been continuing on, where partnership between the University of Swansea, Janssen, and our commission has been looking at glycemic control and trying to get patients to adhere to their medicine, reduce the burden of cost in the health service, get them into a better lifestyle, and the whole thing then comes together because these are proven therapies. And I want particularly to emphasise in partnership, when you want data, then this sale database from Swansea is absolutely vital. It's a really remarkable resource Wales has got. You know, very few other countries of the world have such a database that tells you where people are, what they've got, and so on. And that's a really good thing. So there's an example of partnership between a group of people that's really made a difference to the lives of people in Wales and the cost of health. We're going to hear today from this whole array of different companies, and they're going to show examples of how they have been working both here and elsewhere in partnership. And I want to emphasise, again, that it's not just about them and the NHS, it's truly about the patient. The industry had a difficulty working with patients. People felt that somehow we were sort of dominating, and because we were big pharma and so on. But realistically, that doesn't work. You've got to have a contract between the patient, the carer, the provider, and the company. And so that is really also something that I'm delighted to say you'll find in your brochures, that the All Wales Medicine Strategy Group, working with the government here, has created, if you will, a working document of how we should work together, so there's no pejorative relationship. But that is really key for me, that unless we talk to the patient, involve the patient, and we can discuss what that means, is it the representative of the patient or the patient themselves, then we're simply not going to be successful. Well, that's certainly true. The ownership of that is certainly true with Wales ABPI, and this is from the manifesto that Rick and his colleagues have drawn up. So that's the objectives, to work in partnership with common commitments and working with partners to support these values. That is the central ground of what ABPI does in Wales. Hopefully, though, we can continue to do that without despair. So what I want to do is leave you with the thoughts that we need some disruptive thinking. We can do what we've been doing and do more of it. But I think we've got to think out of the box about what could we do differently, that we could move the needle to really get this improvement with health and well-being. So the challenge for today's meeting I give you is this: what can we do best to work together to improve and sustain the health and well-being of our fellow citizens, and deliver better health care that can transform lives, cure diseases, and particularly adding years to life and life to years. And by we, as I say, to emphasise again, it's not just industry, government, NHS, it's the whole of this community here. So that's the challenge for us as we go through today, and we get fortunate to have some really outstanding speakers, and hopefully Minister will arrive at the end of the day to give us his words too.